It is a great honor to speak to you because you are sort of front and center in saying we're not going to do the remote learning, we're going to do residential learning. What's your bar for shutting down the school? How do you deal with that?
Yeah, well, thank you, Alex. Let me, if I can, first take a moment and say why we are deciding to reopen, because that is important to understand when you understand the bar. So we decided all along, back when we started planning in sort of the April-May timeframe, that we were going to be driven by science and by data. And we did a fairly detailed, actually quite a detailed epidemiological study. And what we determined was that it was actually safer to bring our students back. The reason for that is many of our students, about half, live off campus. And we know from surveys that they will be coming back anyway, whether we're online or in person. And if we're in person, if they're in our classrooms, if they're interacting with our faculty, if they're using our facilities, we are much better able to compel them to participate in a very rigorous virus testing program. They'll be tested twice a week with follow-up isolation and contact tracing and quarantine, and to participate in our behavioral compact, our student behavioral compact. So our model showed that we had fewer infections, and we've pushed on that model all summer long, and it continues to show that. Now, as you know, this is a changing situation, and I will be honest, we assess this model and reassess it every day. We update it, we review our operational procedures. We're putting in place, as are many universities, a color-coded alert level system. And we're going to be looking at things like number of infections, where those infections are they in small clusters that we can quickly isolate, working with the county health department, or more widespread? What's the hospital capacity? What's the quarantine space capacity? And as we look at those factors, the moment it becomes clear that the conclusion flips, the moment it becomes clear that it's safer not to have students here, no matter how much disruption it will cause, we're going to shut down, because our primary commitment, my primary commitment, is to do what's best for the health of our community.
At the moment, Martha, a lot of data points to the idea that we are seeing huge transmission in places that students gather to drink and to eat. Certainly, you're seeing that with young people around the world. How do you minimize that risk on campus and in the region around the campus?
Yeah, that's a great question, Guy. It's exactly what we are worried about. There are a number of studies now beyond the model we did, which show that it is safe to open if you have a very rigorous testing program. As I say, we're going to be testing all our students twice a week with very good follow-up and very good contact tracing and isolation. I don't doubt that there will be some of that behavior, although I have to say we've had a number of students around all summer. Over the course of the summer, we've done more than 5,000 tests, and so far we've only had 4 positives. But it will happen. Again, the point is it's going to happen whether we're open or not. Students will be in Ithaca living here. And so what we want to do is to the extent we can, work with them to have the best possible health practices, and then also to do this testing.
How do you do testing twice a week? I mean, I just anecdotally, CityMD here, at one point, it was like 17 days to get a test result back.
Yeah. So this was something we knew from the beginning was very, very important. And as I say, it's been confirmed even by statements by Dr. Fauci and others, that's the key. So we started early on building our own surveillance testing lab. So what we have is a lab in our veterinary school, working in compliance with in collaboration with the local Cuba health system. And we are able to do, using pooled testing, 50,000 tests a week. So by pooled testing, you take 5 samples, you collect them together. If it's negative, you can sort of clear that whole group. If it's positive, you then separate it out. What then happens if in this surveillance process you find a positive, you then send it off for confirmatory diagnostic testing through the health system. We have been testing this, and we're turning them around in 24 hours.
Wow.
Martha, if I'm an engineering student, I'm probably doing 40 hours a week plus taught. If I'm a history student, I'm doing a fraction of that. How do you assess the risk for an engineering student versus a history student? Do they need to be treated differently? And how do you kind of make sure that the history students and the engineering students kind of stay apart? Because their trajectories are very different in terms of the time they need to spend on campus.
Yeah, well, first of all, I do want to be clear. We are opening for in-person education, but we're going to have a mix of online and in-person classes. So, for example, our very large classes, they're going to be taught online because we simply don't have big enough spaces to put, say, 200 students with the appropriate distancing between them. So not all of our classes will be in person. In terms of what happens in the classroom, it really doesn't matter whether you're an engineer or a history student. You need to be wearing a mask. You need to be sitting in assigned seats so that if there is a positive, we can do appropriate contact tracing. You need to be sitting 6 feet apart. We've been working on our ventilation system, so they're all up to par. So I'm not really sure that there is a difference between being a history student and an engineering student. In all cases, what's important is behaving in ways that are appropriate in the current pandemic, and then most critically, and it's mandatory, participating in this testing program. I also want to note one other thing, because when people think, oh my God, they're going to do this testing twice a week, that's going to be awful. The initial test will be nasopharyngeal, so that test where they go way up your nose into your brain almost. After that, for surveillance testing, we can test in the front of the nose. It's called anterior nares. And then if there's a positive, it's confirmed through the nasopharyngeal test.